the presentation. I am Dr. Joseph Telfair. I'm the Associate Dean for Practice and Research here at the Jiann-Ping College of Public Health. And along with my colleague, Ms. Janet Chango, we run the Office of Practice and Research here at the college. We are extremely pleased to welcome today two of our distinguished personnel. We would first want to welcome Ms. Prachi Joshi, who is a second-year DRPH student here at Georgia Southern in our college. Her recent interests includes women's health, maternal and child health, occupational health, and her research is really focused on developing a theoretical intervention model for opioid addiction prevention that would create awareness, improve organizational policies to address opioid in the workplace. And she is accompanied today by her mentor, Dr. Atin Adhikari, who has more than 10 years of experience in environmental and occupational health research in many areas. He joins us from the University of Cincinnati in the College of Medicine, and now he's with us here, and he's been here for a number of years, I think around 7 years, Dr. Adhikari? 7 years, exactly. So he was previously involved with a number of broad range research projects that included exposure assessment to air pollutants and microorganisms, microbial contaminants in the indoor and outdoor environments, microbial exposure among community groups, and a number of other related projects. So he has supervised more than 3 CDC, NIOSH, NIH, EHS, and US HUD supported projects as the PI. And he served on the DoD projects in a number of other areas. And he's well published, more than 67 peer review articles in research, and he actually reviews for a number of prestigious journals. Today, Dr. Adhikari and Ms. Joshi will discuss their experience in developing a successful faculty-student mentoring relationship while involving a class assignment, into a full research project on developing a theoretical-based intervention model for prevention of opioids. So the presentation will actually capture the importance of collaborative partnerships that are required to actually build such a relationship, as well as the more positive and instructive elements of what it means to be a mentor, and in the rewarding aspects of the mentor-mentee relationship. So they will also, fortunately for us who are in the learning mode, will discuss the challenges in the lessons learned during this collaborative research and successful process. So I'm hoping that they have that part. And we will definitely have a little time at the end. They'll present for about 45 minutes or so, and we'll have some time at the end for question and answers. So without further ado, I will turn it over to Dr. Adhikari and Ms. Joshi for, I expect it to be a very enlightening and strong presentation. Dr. Adhikari, the floor is yours.
Okay. Good afternoon, everyone. Welcome to the first Dyad Seminar of this academic year. First, I would like to thank Dr. Telfair and other staff of Practice and Research, Office of the Practice and Research of our college for providing this excellent opportunity to me and Prachi. So today our main speaker is Prachi, Ms. Prachi Joshi. She was my student in Environmental Health and Occupational Health course in 2018. That was a doctoral course, and Prachi will tell you how a small class research study became a actually it was a small class assignment, and that became a research study, and she's working on it right now and current progresses. So before she starts, I will say a few words about my mentoring experiences. So as you all know that the occupational health is a very broad field, and I am involved only in a few research areas. But when I am teaching the course, then I am teaching all aspects. I am teaching the exposure assessment part, workplace hazards. I am teaching the chemical nature of the pollutants in workplaces, health outcome assessment, and also healthy behaviors of workers, how we can train them, as well as the leadership policies and global health issues. So engaging the students in all these topics in this course is really challenging for me. Moreover, I am not knowledgeable in all these areas, so therefore I always adopt some kind of tricky strategy at the beginning. So what I do, I always try to listen and understand about the students' previous public health experiences. And usually I challenge them. After that, I give them some tasks which are closely related to emerging research areas of occupational health as well as public health practices. For example, today Prachi will talk about opioid addiction among workers, and this is one of the current emerging very hot areas of occupational health, one of the hot areas. Secondly, I always try to serve some resources to them so that they can navigate their next steps after completion of the course. They can find some job opportunities, internship opportunities, and also I usually connect them with my colleagues who are very engaged in occupational health research and practice. Third, because this is a doctoral level course and these students are doctoral students, they have some previous experiences. I always try to encourage them to use all those previous experiences, their capabilities, and so that they can use independently all of them, and which can be relevant to their career advancement. I also provide them information on ongoing educational and training opportunities. And finally, I think this process is always bi-directional. I always encourage the bi-directional exchange of information between teacher and students. So some doctoral students, they have some previous experiences. I always encourage to share that. I always learn those, and those are great experience for me too. So in brief, these are the ways how I engage them, motivate them, and empower them. Okay, Prachi, now you can continue.
So good afternoon, everyone, and thank you, Dr. Telfair and Janet, for giving us this opportunity today to present. So I will be presenting my whole mentorship journey and this experience when we were working on the theoretical based intervention model for opioid prevention. So so just to give just to give the presentation outline, we will start with an overview of the research, what was the research and what was the rationale of conducting this research. And then we will start with a mentorship journey and how I was introduced to the occupational health, how we defined the goals, how we conducted the actual research, and then what were the learnings from this entire study. And also we will share our future plans for this study. So in terms of the overview, of this research, we found that there was data which clearly mentions that how opioid addiction is a growing problem in the United States. And according to the U.S. General, it was estimated that 2.1 million people in the United States were affected with opioid addiction. And when I was taking this class, I realized that opioid addiction among the construction workers was very high. And one of the primary reasons for that was that they are particularly involved in a very physical intensive labor, and because of that physical intensity, they had to take painkillers, and most of the painkillers have opioids. So unknowingly, these laborers, they get addicted to opioid addiction that not only harms them physically but also mentally and socially, so which can also lead to loss of job. So considering this problem area, we started with this idea that we need to explore more as to how an intervention can be designed for these construction workers uh, to you to prevent them from addiction. So going to certain facts, since 2010 the number of opioid deaths have been doubled. The impact of opioid overdose abuse is also common in several intensive and stressful occupations, as I already mentioned. And 400,000 people have died from and 400,000 people have died from overdose of opioids between 1999 and 2017. So, and it has been increasing, like there has been an increase of 25% in 2017. And the total societal cost, in which is the cost burden of on the society, is like around 25.6 billion. So these facts were were very compelling for us to conduct this study. And so when we started working on this study, we already realized that there is already a framework. National Institute of Occupational Health has already has a framework, which is which has been broadly divided into uh, four four parts, which is identifying the workplace condition, determining the risk, then developing the methods of detection and decontamination, and then protecting the workers and responders. So when we saw this framework is basically based on a socio-ecological model. And so I mean, for those who don't understand, like the concept of socio-ecological model is to identify risks at different levels, like at an individual level, at the organizational level, at the policy level. So at different levels, you have to identify the risk that push a person towards addiction of opioids. So we realized that the NIOSH framework is only doing half of the job, which is identifying the risk factors in the environment, but they are not addressing the main issue of how to prevent these workers uh, from the addiction. So for that we we try to merge the NIOSH framework with the trans-theoretical model. And the reason we use the trans-theoretical model is because trans-theoretical model has been used previously in many addiction theories. And it has been the reason why trans-theoretical model came into existence was primarily because of the smoking cessation study. So the six main stages of trans-theoretical model is pre-contemplation, contemplation, preparation, action, maintenance, and termination. So at the pre-contemplation stage is that the person is not aware, which, like, we can say that the workers are not aware whether whether they are addicted, and painkillers are the reasons for their addiction. So they are not aware, and they cannot foresee that they are at risk of getting addicted to this to get addicted to opioids. Contemplation again is the stage where the person intends to start a healthy behavior, and contemplation can only come if there is an intervention designed where that awareness is raised among the workers, where we can push the workers to understand if that they can adopt a and they can avoid this risk of addiction if they adopt a healthy behavior. The third stage is the preparation. Again, in this, the first thing is that the person starts taking small steps. And for that we realize that these small steps can be taken if the environment is supportive for the workers. And by environment I mean the work environment, the family environment, the peers, the friends. And fourth is the action stage, where people have like recently changed their behavior and intend to keep moving forward. And it can only happen, like, one of the ways that it can happen is that when your friends give you a positive reinforcement to move forward. and through continuous positive reinforcement from the friends, from the from the employers, from the family, the person is able to maintain that behavior, and that can finally lead to termination. That is the trans-theoretical model, like I've briefly described. um, that we have That's how we try to portray, that's how we try to merge the trans-theoretical model with socio-ecological model. So this is the model which we created finally by merging the two trans-theoretical model and the NIOSH framework. So if you see the oval shaped boxes are like the four stages of the NIOSH model, and on top of that is the transtheoretical model and how they are going to do it. So if we just think about pre-contemplation and contemplation, we will see that they are matching with the identify stage, where we are identifying who are the people at pre-contemplation stage and who are the ones that are at the contemplation stage. So that this can be done through a questionnaire survey, where we can identify if the people are aware whether their painkillers include opioids or not, and then how we can, if they're not aware, then there will be a different intervention strategy, and if they're aware, then there will be a different intervention strategy. So then comes the preparation and action, which is also determining risk. Now when we determine the risk, we can help the person to prepare and take action when we know that these are the risk factors within the environment. Sometimes the workload is so high that the person is so overloaded with work that they have no option than to take painkillers, and because of the physical intensity. And in that case, I think that case we can just collaborate with the employers and see if they are given enough breaks in between, so that they can get like their physical intensity can be reduced. Then the third is the protect, which is also part of the maintenance, that by like as I mentioned earlier, that through the environment and through the collaborative and cooperative environment, so maintenance can be the behavior can be maintained. And finally, by this termination is very much aligned to the NIOSH framework of decontamination, which is completely removing the all the risk factors from the environment, to so that the person can maintain that behavior throughout. If you see the model outside, I have like we have done healthcare providers, and we have mentioned employees, peers, family, and friends, because they are like though they are mentioned outside the model, but they are very very instrumental in bringing about this change in behavior of the workers. And one of the reasons is that why I said healthcare providers is particularly because so that the dosages of the medicine or the painkillers can be maintained, and families and peers and family friends, they are instrumental in motivating and giving positive reinforcement to the person for taking action towards a healthy behavior. So this was the whole study, and this was the overview of the whole study. Now, I would like to just take you through the journey of the mentorship journey, and that how it started. So I think the whole journey can be divided into 5 phases. The first phase is get to know each other, like the mentor and the mentee needs to know each other. And when I say get to know each other, I mean their area of interest should align with one another. Then the second phase is the defining the mentoring goals, like that can be defined, that can be communicated between the mentor and the mentee, where the mentor can guide the mentee in defining, like developing skill sets, what skill sets is required to conduct a study, and developing trust with one another, where there is a clear channels of communication and trust is developed. And then support and encouragement from the mentor and from the mentor is very important. So third phase is the research, and the research phase is when we are actually conducting the research, where we need a lot of collaboration, networking, and partnership, not only from within, not only from the outside of the college, but also within the college. And I will talk about it in detail in the going forward in the other slides. Then reflect on learning. That's very important as a to develop a relationship between the mentor and the mentee, so that we learn from our mistakes, and we learn from our mistakes, and we can improve on how we move forward with the study. And the last is the plan for the future, which is like how we, like, okay, if there is a model, but what we are going to do with that model is I'm going to discuss in the future slides going forward. So first is like get to know each other. So when I say get to know each other, is like I will just give a brief experience of my introduction to occupational health, and how a mentee can and how a mentee can um, get to know the mentor. So first of all, the first step, I mean, like from my perspective, I can say is that a mentee needs to identify the mentor. The mentor is and the mentor, so to identify a mentor, you need to understand the interest, area of interest of the faculty, and that best matches with your study idea. So once you identify the mentor and the area of once you identify the area of research, you've identified the mentor. The third stage is like identifying how the your research idea fits into the research interest of the mentor. And once you know that this is where it merges well with my with where my research interest merges well with my mentor's research interest, that's the time when you can go and communicate to the mentor. And that's exactly what happened with me. Like give you a brief example of how I started was because when I was introduced to health, I had no experience of occupational health. But when I was taking these classes, and there was a whole class dedicated to construction workers, and there from there this idea came into my mind of opioid addiction. And and then I started looking at other area of interest for Dr. Adhikari, and I realized that he has done a lot of work in occupational health. And once I identify that his research that his area of research matches or fits my study idea, then I communicated with him, and then that's how we. And then I communicated to him, and then he asked me to take that idea and develop into an assignment. Like it started with a small class assignment, but then he asked me to take it as an assignment topic and then submit him my idea, and that was like a kind of a platform he gave me to present my ideas to him. So I think this is Dr. Adhikari's past research experiences, and I think Dr. Adhikari I would request Dr. Adhikari to please take us through this slide.
Okay, I would briefly describe these few areas which I'm addressing right now. First, let me tell you that I am teaching two courses here. A brief about these two. One of that which Prachi took, that one is doctoral level course, Environmental and Occupational Health, UBH 8132. We are offering this course in spring. And also I am teaching a new undergrad course, Occupational Health in Public Health Practice. And in both of them, because we are College of Public Health, so we are not focusing the safety issues so much, but we are addressing more on the public health practices. So these are the 6 different areas of occupational health. And I have done some work earlier on exposure assessment and respiratory protection for workers. Right now, we are continuing some study right now, and we are trying to understand how the different models of respirators are working against airborne particles, airborne microorganisms. Also, in the workplace, there are many other environmental factors which can influence all these exposures and health effects. So we are studying them, different types of gases, particles, and biological agents. And when we are talking about biological agents, some biological agents are infectious microorganisms, and you need some kind of special inactivation techniques for that. Like viruses, bacteria, and I explored that earlier when I was in University of Cincinnati in a DoD project. And right now I am more interested in some educational interventions, behavior changes, training programs, that kind of work, because Prachi is actually right now focusing that type of work. And also definitely the health effects is one of the major areas of interest. Okay, that's it. Prachi, you can continue.
Thank you, Dr. Adhikari. Um, so once I realized that his area of interest for matches with mine, and his research experiences matching with mine, so I realized that that's the best way to start the study. So the next phase was to define the goals, like how are we going to define the goals. So the role of defining, so the roles were defined as a mentor and as a mentee. So the mentor's role is mainly to provide professional guidance, which Dr. Adhikari provided me throughout my study. He uh, providing the leadership, by providing the leadership role, I mean that there have been instances where I in fact learned how to mentor someone. So it was more of a like a training for me as well when I've observed him in the leadership role. One of the one of the experiences which I can share through this is that mm, when when he, like when there has been there has always been instances when when we are communicating or when we are talking to other organizations for some help, and they're not responding. So Dr. Adhikari has always given me a front foot to interact with or network with organizations and network with professionals, uh, which kind of give me an kind of give me an exposure to help me for my professional growth. And that was the leadership role he played in this whole study. Then sharing research relevant knowledge and experience. Dr. Adhikari has a lot of experience in occupational health, and I was very new in this area and didn't know the nuances of this field. But his research experience kind of pushed me um, towards achieving this goal, and identify and resolve potential obstacles. So when I talk of obstacles, so sometimes it so happens that when you're communicating with outside organizations, your organization might not respond to you promptly, or they might not respond to you immediately. They might, the communication, some organizations have a very like the communication channels are very slow. And in that case, you keep sending reminders. And in one of the organization, when I was talking to them, I realized that their response rate is very slow. So Dr. Adhikari always kept telling me to send them reminders. I kept sending them reminders. And after third reminder, when he said that they're not responding, then Dr. Adhikari stepped in and resolved this issue by directly calling them and talking to them. So that's how, as a mentor, you can identify and resolve. Like, you can always put your mentee, like, this is what, like, I learned through the study, that you can put the mentee in the forefront. But then if things are not working it out, then you enter. The second is the conducting the research responsibly, and by that I mean that Dr. Adhikari always made sure that, if I am doing a pilot for this model, then my IRB is done, and all the ethical consideration needs to be guided properly by the mentor. As a mentee, my goal setting was to professional, like how this study is going to help me professionally. And second is that can like taking feedback from the research. So I always felt like that, like, s- taking feedback positively is the I think is the biggest, is taking all the feedback positively is one of the most important role a mentee can perform. Because uh, because because of the limited knowledge I had in occupational health, I even if it's a very, if, even it's a brutal criticism of your work, always take it positively, because it's in a way it's guiding you in the right direction. That's how I've always believed that. And disseminating your work to the external audience. And so when I was doing this project, Dr. Adhikari always told me that, I have to identify the journals where I need to publish my work, and he told me the ways in which I can identify the journals for my work. and that kind of helped me in understanding how we can identify journals, or how we can present ourselves to publish our work. And then building networks, that was also one of the roles, with Dr. Adhikari said that, that's why he kept me in the forefront when talking and communicating to the organization, so that it kind of builds the network. He also pushed me to present my work in different conferences. Like, I presented this work in APHA, and so he's always been encouraging me to present in different conferences, so that, to get feedback from there. So the third phase is the conducting the research. So when I so in conducting the research, also there are two roles, like the role of the sorry. So the role of the so role of mentorship. So what is the role of mentorship in research? Is that mentorship is that mentoring involves multiple relationships, and when I say multiple relationships, I feel that uh, what I have learned through this study is that my relationship while conducting the study is not only limited to my mentor, but also it was involved in multi-directional in ways, to the organizations I was talking to the to the companies, like construction companies that I've been talking to. And also Dr. Adhikari also asked me to, whenever I'm like whenever I was working on the theoretical aspect of it, which he said that it's not his forte, and he encouraged me to, go to other faculties. Like, he recommended Dr. Smallwood to me, and I went to take his help. And so, even internally, you have to work through multi channel relationships you have to maintain within the organization and outside. um, Second, while doing the research, information sharing is bidirectional, and Dr. Adhikari already mentioned it in the beginning of his introduction, that how information sharing was bidirectional in this case, where there were certain areas which Dr. Adhikari felt is not his forte, and he clearly gave me, he directed me towards other faculty members who were more expert in that area. And also, it was a learning for both me and Dr. Adhikari, for sure. And then the formal and informal relationships are valued, and by that I mean that and also I would like to club it with the fourth point, which is that how formal mentoring also includes informal attributes. Is that sometimes it so happens that, there is such a certain emergency that you really need to talk to your mentor, and it in one of the instances it such happened that I needed an information which for which I wrote an email, but I couldn't get the response, like in the time frame I need. Also, as a mentee, we need to understand that our study is not the only thing our mentor is doing. They have other responsibilities and roles as well. But in that case, if we have that trust and understanding, so you can, immediately go and talk, pick up your call and talk to your mentor, and mentor will appreciate that, even though that's a very informal way of approaching, like professionally, but that they will appreciate it, because considering the emergency or the urgency of the situation. Then is the interaction frequency, and in this study also interaction frequency was the key, because we used to meet, like we have decided the day we meet and discuss this project and how we move forward, and how we move forward. So every week, one day in a week was dedicated to this study, and we move forward with that. Then last is the perceived similarity, and perceived similarity is like when I and Dr. Adhikari together felt that this study is important, and that we realize the importance of this study. So it is very important that both the mentor and the mentee are on the same page when it comes to setting up these conducting their research. So when I talk of mental support, I thought that so I realized that it is psychological and emotional support. Uh, this when I say psychological and emotional is like, because sometimes there can be in a study, there can be a lot of ups and downs. Some people are not responding on time. People are not uh, like attending to your calls, or they're missing your calls. So it can be a very pressurizing situation. But if the mentor is supportive, and the mentor steps in, like as I mentioned earlier, like how Dr. Adhikari stepped in when I was not getting response from the organization. So that kind of helps to establish trust with the in the relationship between mentor and mentee. Second is support for goal setting and choosing a career path. So Dr. Adhikari has always recommended me, because he thought that he realized that this study can be instrumental in guiding my career path as well, and he also recommended few of the internship opportunities to me in this direct in this in opioid addiction. And so that kind of helps me, it kind of gives me an edge professionally as well, and develop and even at the level of personal development. Third is the academic subject knowledge support is like, because as I mentioned earlier, I had, before taking this class, I had no idea about occupational health, and no idea how I can use my community research into occupational health. But my community based experience and Dr. Adhikari's occupational health experience kind of uh, bridged that gap of not that knowledge gap which I had, of how to club my research into the occupational health. So, specification of a role model is like sharing life experiences and feelings and providing an opportunity to observe mental socially. So, like as I mentioned earlier, like in many instances, I have seen how Dr. Adhikari has stepped in supporting and taking if something is not right, not going right. Apart from that, he has pushed me to present in different conferences. Also, he has guided me to different organizations that I can approach to pilot my study, to pilot that model. And that is still happening. I mean, that's still in continuation, in progress. So, reflect on learnings. Well, I would say that reflective learning can be in three. So the first way in for this study, we we realized that research findings so what was the research findings of this whole study, and who are the end user. It is very important for the mentor and the mentee to sit and understand who are our end users, who can be a dissemination partner, how can we communicate and evaluate our plan, and then disseminate the whole work, the study plan that we have uh, that we have made, that we have conducted, the whole research. Also, contingency plan is very important in this study. Also, we realized that how why contingency plan is important, because uh, a contingency plan can always be formulated based on the probability, and the higher the probability and the impact. So if the probability of certain thing going wrong is high and the impact is high, then we definitely need to have a contingency plan for that scenario. If in certain scenarios where uh, probability of something going wrong is low, but the impact is high, but the impact is also low, then you might not make a contingency plan. But still, I think for every scenario, it's better to have a contingency plan, because certain things are not foreseeable. Like, for example, in our case, COVID was not foreseen when we were planning things for us. Like in certain now we are we were talking to the organization and everything was going smooth, but suddenly COVID came, and we are again back. We fall back on track. So contingency plans are very important when doing a research project, and especially when we are dealing with partners outside our institute and colleges, like because anything can go wrong. So that was one of the learnings we had from the study, to have a robust contingency plan. So the future plan for this study is that we would like to collab. We are in talking. We are talking about to other organizations and to our networks. And Dr. Adhikari has networks in within the occupational health. Also, he's talking to his network. So, our idea is to pilot the model which we have created. So the pilot, we are not taking it in a in a large scale, but even in a small scale, if we can pilot this model, that's what we are looking forward to. So the thing was that as I mentioned earlier, that we have been working for even for future plans, work collaborating with organizations, collaborating with private companies is again one of the it was an agenda, and developing a contingency plan because of COVID situation. We had to shift our whole plan. So, and strengthening professional and personal networks. And I would request Dr. Adhikari to please, if he wants to give a brief about the uh, organizations that we have been talking to, that would be great. Thank you, Dr. Adhikari.
Uh, Particularly for this project, we were talking with the Center for Construction Research and Training, and actually we got a small grant in 2017. We got a 1-year grant, and in that grant we were going to different construction sites, and we are measuring the exposure levels, and we are evaluating a number of respirators for protecting workers from silica dust. So Prachi was, that's why I had some connections with them, and they had some student training opportunities. I introduced Prachi with all of them. I knew the coordinator there. So Prachi met, already scheduled some meeting with them in the APH meeting. So that was also a good opportunity for her. In addition, there are some other opportunities from American Industrial Hygiene, uh, um, American Institute of Industrial Hygiene, and they also have some student learning opportunities. So I provided that, and also Prachi is communicating with some local construction companies, right? So yeah, you can talk about that as well.
So thank you, Dr. Adhikari. So I have been talking to Marsh Construction, which one of again Doctor which was recommended to me by one of Dr. Adhikari's through Dr. Adhikari's network, and we are still in talking terms with them. But the only problem right now is because of COVID, they are not able to, like, the workers are not able to be able to be participating in the study because of this situation. So which we are assuming, or what we are anticipating right now, is that by the starting of the beginning of the next year, we would have some breakthrough with with the pilot of this model. That's what we are hoping for. um, So, so that's all from our side, and thank you very much for being patient and listening to this presentation. And if you have any questions, we are open to answer any of the questions if you have.
So just a reminder, thank you both. For this presentation. We appreciate it tremendously. So we can give everyone a hand for them. They've done a phenomenal job. You know,
Thank you, Dr. Zulfan.
wonderful. So two ways you can do questions. You can raise your hand for questions, and or speak up, as well as put the questions in the chat, and I will follow the chat, or we can follow the chat. So we have our first question in the chat. It is from Miss Karabi Barai. And she asks, how do you cope with the stress of doing outside research project, doctoral level courses, and maintain your personal life simultaneously? So how do you be a student? Is what our question is. And so how do you balance the three at the same time? And then what's your advice for a junior doctoral student who are interested in such research projects. So there's a bunch of questions there, but I think the first two obviously are, how do you, Ms. Prachi, be a super student? And then the other one is probably directed more for both you and Dr. Adhikari, if we can go from there. Okay, all right.
So when I say about like managing like two three things at a time, I think the best is like scheduling is the best way to do it. And sometimes, like if you divide the time slot, like say 6 to 8 I'll be working on this, and if for 6 to 8 if your work is not done, but then we keep on continuing doing that work because it's not done. But usually, if 6 to 8 whatever is done, move on to the next thing, because that's how the scheduling works. Because that if you're managing two three things, and you have to uh, you have to create a very short term goals in your schedule, like very short term goal, like today this is what I'm going to complete, next day this is what I'm going to complete, and very short term goals needs to be achieved. I think when time management, scheduling is the key. That's all I can say.
Thank you. Dr. Adhikari, did you have anything you want to add?
No, I think Prachi, you didn't address the stress management issue. The stress is a common problem, not only for the students, it's also for faculty members too, because we are teaching so many courses and we have to do research, we have to do service, all those things. So for stress management, I think not only time, but you need some good balance between your other aspects of your life and work. So if you can manage that balance properly, then definitely it will you can reduce your stress level.
So personally, I practice meditation. So I think meditation helps me a lot in the morning, like to manage my stress, and I think that helps me a lot with stress management.
All right. Thank you both. Other questions?
Dr. Telfair, I have a
Yeah,
comment if I could.
of course you can.
Okay, I just wanted to say fantastic presentation from both of you. Dr. Adhikari, I don't think I had managed to be able to see one of your research presentations, so this is the first opportunity that I've had to view one of your presentations related to research, and it was definitely it was very insightful, and I really want to commend you all on the mentoring framework. Just sort of taking a step back with looking at the mentoring process without it being specifically related to a particular research interest. I definitely would say that if you moved on with using that framework with regard to pedagogy and maybe doing a manuscript on the mentoring process, that framework would definitely be appropriate. So kudos to both of you.
Thank you
Thank you.
very much.
Thank you, Dr. Megambo.
So from our chat box, you have multiple agreements with Dr. Mayo Gamble, and I would like to make a note that Dr. Mayo Gamble was one of the first, as you all recall, to present for this Dyad Seminar, and of course received comparable accolades, if I can put it that way. Okay. Other questions or comments? Give a minute or so. Well, I have a question, then I will start the conversation. So I understand that given the kind of work that you do, Dr. Adhikari, I know Ms. Prachi is one of your mentees. Do you have other mentees? And then if you do, how is it that you select them to work on how do you select them, first of all, and then which projects do you work with them on?
As Prachi said that first of all, I usually involve them in some small class assignments.
Mm-hmm.
And if I see that they are really interested in that and they are addressing some knowledge gaps, some loopholes with their own interest and their own previous experiences, and also those are matching with my interests too, then I always encourage them to move further. Then I involve them in some actual research project, a small pilot type of project.
Mm-hmm.
That's how I start, and after that I also connect them with other connections that I have already with other colleagues or other NIOS networks or research networks. So that's how I always.
Okay. And so, Miss Joshi, in given that you are a third year student and you're working on completing your dissertation at this point, how does your work with your mentor parallel with what you want to do for your dissertation?
So the thing is that it's not the same thing which I'm doing for my dissertation and for the study, but the as I mentioned earlier, I was not planning to make it parallel to my dissertation because the whole idea was that we will be get done this summer. That was the whole idea, but because of the COVID situation, it didn't go well. And right now, we are also I and Dr. Adhikari are still contemplating on how to balance it out because it's not like that I have to move forward with this research. It's just that even if I have presented a model, I can publish it and it can be used for future for a future pilot uh, by other student as well if they're interested in the same thing. I want to do it, but then I still want to see how I can manage my time with this pilot and my dissertation.
Okay. Thank you both. So, other questions, other comments? All right. So just to everyone on, the purpose of the seminars is to illustrate, as Dr. Mia Gamble made perfectly clear, to look at models of mentoring and models of relationships, and to really illustrate the realities of what that really means, and to really promote, particularly here in our college, as you know, we value the relationship between faculty and students, and we look for every opportunity to make sure that that happens. And we wanted to really highlight that because we see that, we know that as a real strength of our college. So, and just so that you know, this is why we have these seminars. This is our purpose. It's not grand, not really grand. It's just a very simple purpose, is to highlight the phenomenal work that's being done and how it's being done, what is approaches it, and that's being done. And so that you could yourself, in some way, shape, or form, could learn from these and on that one. And that note, I hope you could follow up with both Ms. Joshi and Dr. Adhikari. So as we close out, I was wondering whether you're, first of all, as we always do, parting comments, suggestions, and so forth, Dr. Adhikari, that you would like to lay your wisdom, so to speak, on the rest of the audience before we go. Any words of wisdom?
Definitely, this is a great experience, and like mentoring students of other disciplines, those who are also and those who have very little knowledge in occupational health. But it's a privilege for me too, because I am also trying to understand how their previous experiences can be connected with occupational health and how we can develop some new ideas. So that's a very good experience, and I hope that other students, they will be interested to follow Prachi, and in the future we will continue more and more collaborative research involving students.
Thank you. So the teacher can learn from the student, is what you're saying as well.
Yes, sure.
Okay, Ms. Joshi, any parting words of wisdom?
Well, I can just say that from the mentee perspective is that It has been a very enriching experience, a completely new area for me, a new field for me. And sometimes I feel that, sometimes I feel that we should not confine ourselves into silos. Like, we are community health, so we'll just look into community health. Sometimes it's a good idea to expand yourself, and to see how my community health experience can expand to other areas of public health. And if we go by this expansion of thought, then I think definitely something really good can come out of it.
Thank you. So we should practice one of the core areas of public health, which is cross-discipline collaboration, and learn
Yes,
from it.
absolutely.
Yes,
Okay.
I agree.
Okay. All right. So we have okay, last comment. So Ms. Chungo has said that please join us next week. We have Dr. Mays will be conducting our first grand rounds of the semester. And having said that, you will get notices from that. So anyway, you have our Ms. Chungo and myself, and are very grateful to Dr. Adhikari and Ms. Joshi for their excellent and outstanding presentation. We are hoping that they could share their information in terms of slides. We will bug them until they do with the rest of us. And so thank you all for attending. And we hope that you learn from this opportunity and that you give us feedback and what you think and any ideas on other persons do this. And we hope that this also stimulated you to consider jointly presenting as well. So we thank you for your time, and we hope you have a good rest of the week. Be safe. And if you have not done so, please remember to vote. Take care, everyone. Bye.
Thank you.